I don't know if I saw either one of you out there today, but my name is Jennifer Newman, and I'm a community relations representative with Tidewell. And my job is to educate our community on what our services are and to make sure that people understand what palliative care is, what hospice care is. So today, if you look up there, you're going to see we've got Tidewell Hospice and we have My Life, My Choice. This is really a condensed version today because we don't have a lot of time. Under the Tidewell Hospice portion, I'm just going to explain our services and what we do. My Life, My Choice is a complimentary program that we offer through Tidewell. I am an advanced care planner, a certified advanced care planner, and I help people do their advanced care directive and their living will. I'm willing to come out for small groups. If you have friends or if you're involved in churches or other groups, I will come out and do that. And that is a complimentary service we have. And we'll talk more about that as we go along. Tidewell Hospice stands by its mission statement, helping people live well by providing care, comfort, and compassion. And it's not just for our patients, it's also for their friends and family. So when someone comes under our care, we are there to make sure that they are taken care of, they're comforted, and they're living their life with dignity. We value respect, integrity, communication, stewardship, development, compassion, and teamwork. So some things to know about Tidewell. We are a nonprofit hospice care organization. There are for-profit hospice centers, and the big difference is the type of programs that we provide and the cost of those programs. Tidewell has the Tidewell Foundation. We have a lot of wonderful donors who give money to support our programs, and as we go along, you will see some of those programs, and I'll refer to those as the complementary programs. If it's a for-profit hospice, patients have to pay out of pocket for those programs. We are the only hospice organization right now that serves Charlotte, DeSoto, Manatee, and Sarasota counties. This was made last year because, this event was postponed. We are now in our 41st year of serving these communities. The majority of our revenue is from Medicare, Medicaid, private insurance, and private pay. We also do take VA benefits. And the philanthropy or our foundation raised $4 million to cover a multitude of the services that we don't get reimbursed for. And again, those are those complimentary services I was talking about. And that's a lot of money. When you think about it, that is a lot of money. So when someone goes on to care with Tidewell, they are treated by a team or an interdisciplinary group. And a doctor, RN case manager, social worker, CNA, dietitian, grief counselors, chaplains, volunteers, and therapists make up that team. And every person, every patient can utilize these, but if someone does not want to see a chaplain or they don't want to see a social worker, they do not have to, but each person is assigned this team. And this team does work together. They meet no less than every 2 weeks to go over the case plan and adjust that as needed. They all talk so they can share what they know about the patient and what's going on. Some of the programs and services that Tidewell offers are the children's services. We actually treat children that have life-limiting illnesses, not necessarily children that may pass away today or tomorrow, but children that do have, again, life-limiting illnesses. We do provide palliative care, pain management, and those types of services to them. The complementary services that I've referred to do include our grief and bereavement services. You may not be aware of this, but Tidewell offers free grief counseling services to anyone in our 4-county service area. And on the 19th, we are having a celebration of life ceremony right here in Punta Gorda at Lashley Park. And I believe it's at 11:30. I'm going to be putting some signs up around here, and you should be able to find it also on the Chamber of Commerce website. And anyone is welcome to come to that. Our grief counselors will be there if you've lost someone recently, or even if it was 10 years ago, it doesn't matter. You can give them the person's name when you arrive, and they are going to announce all the names. So it's just a good way to bring the community together. Along with grief services for adults, we also have the Blue Butterfly Family Grief Center for our children. So if you know of any families with children and they've suffered a loss, it's a wonderful program. Right now we're running the closest one in Port Charlotte out of the First Alliance Church for children 5 through 18. Again, free services. They're served a meal while they're there. They work with their peers, and we have certified grief counselors and social workers that help the children. Right now, we are growing the Port Charlotte facility. Of course, they opened it right after COVID hit, so it's taken a little while to get that one off the ground. But I think right now they have about 20 children attending. Our Lakewood Ranch building was the first one. It is now a standalone Blue Butterfly Grief Center. And the last time I talked to the director of that program, she said they were at maximum capacity with 65 children there. And we also are converting our Ellington Hospice House into one. So a lot of that is just getting the word out that people know what's available and they know how important it is. We have gone to a lot of the local schools and talked to the psychologists and counselors, and they think it's a great program. So now it's just a matter of getting families to utilize it. Tidewell Honors is the veterans program that I talked about. We do a lot with veterans, and not only our own veterans that we have as patients, but we also will do community pinnings for events like Veterans Day, where we might pick a few facilities and go out and pin the veterans they have there. Usually it'll be our assisted livings or long-term care units, but sometimes it is even, we've done Fawcett Hospital, so it's not always a facility. But it's just really, really a special ceremony. We have a veteran volunteer who actually will say a few words. It's a little ceremony, and then they will put a lapel pin on the veteran. And it's amazing. It really is an amazing experience. The humanitarian fund that we have is used to help people who can't pay for hospice. Funds from the humanitarian fund have also been used to do cremations for our patients who can't afford it. Funds are used for a lot of different things. Can even be used for something as simple as an electric bill. So it just really depends on what our patients' needs are. Transitions is a program that we have that is sort of a pre-hospice program. This is also another under complementary. It's a complementary program. The insurance is never billed for this. It is non-medical, but it's for patients who have a prognosis of 12 months or less. And we have our program coordinator and a volunteer go in. Usually it's on a weekly basis. We set it up with the individual. They go in and can do light housework, light meal prep. Sometimes they play a game. They can just be a friend. If the patient has a caregiver, they can also provide respite for that caregiver and give them a moment to go out and do something they need to do, you know, a doctor's appointment, a hair appointment, whatever. So that's really a wonderful program. And it's also an extra set of eyes on that patient to see how they're doing and, you know, how their disease is progressing. Tidewell Wishes Fund is another wonderful, wonderful program where we grant wishes to our patients. We've had patients who, we had one who got to go in an airplane. He had been a pilot, he had Parkinson's disease, and he got to go up in an airplane. That was his wish. We've had simple wishes, a dinner, you know, a husband and wife had a special restaurant. If the patient's able to go to the restaurant, we take them. If they can't go, we bring it to them. So we've done all kinds of things. And another wonderful one that just happened was a wedding in January. We had a young man who had battled cancer for 10 years, and he was in his early 20s. He and his fiancée wanted to get married on New Year's Day. And with the grace of God and the help of a lot of wonderful people, we were able to pull that off. So I don't think there's any wish that's too small or too big. We try to make it happen. And the nurse residency program is relatively new. We always need nurses. And so now if an RN has just graduated, she can come into our nurse residency program. She's paid a full salary and has training for a whole year with Tidewell staff and nurses. And all of those programs are paid for through our Tidewell Foundation. So some of the hospice services that are available, well, first of all, Hospice Care is a Medicare and Medicaid benefit, and this is one thing that a lot of people do not know. So when I go out and talk to the community, I always make sure that people know that if you've paid into Medicare your entire life, you have a hospice benefit that is built into your Medicare. If you receive hospice, any of your durable medical equipment and all of your medication is covered under that hospice benefit. You never pay a dime out of pocket. And the same holds true with Medicaid. It is covered 100%. So that's where that little fact comes in. The sooner you come onto services, you can have that stuff paid for, because essentially you've paid for that all along. To qualify for hospice, we do need a physician to certify that the patient has a prognosis of 6 months or less. Now that falls under Medicaid or Medicare regulations where they have to say 6 months or less. Now, does that mean that a patient only lives 6 months or less? Absolutely not. We have patients who actually, what we call, graduate from hospice. Sometimes when a patient comes on to our services, their health improves and they stabilize. If they're no longer showing decline, then they might not be eligible for hospice anymore. So they will go off. As soon as they become eligible again, they come right back on. So we never know, and a doctor really never truly knows how long. The 6 months or less is just based on the normal disease process. Tidewell also serves patients wherever they reside. So if it's in an assisted living, a nursing home, a private residence, it could be in our hospice house, and also homeless patients. We've actually had patients who are homeless, and our teams will go out wherever that patient is and wherever they need our help. And also the jails. I just recently did a presentation in DeSoto County for the Sheriff's Department, and they were aware. They've seen our staff in the jail. We've talked pretty much about transitions. That is the program, that it's volunteer-based, non-medical services, and it is at no charge. And it's just an extra little program that we have to help people and to help them meet their needs, basically. So every time I do a presentation, I always look at the crowd and say, how can you help us? And the best way you can help us is tell people you know about our services. You know, let people know that it's not a scary thing, that it is beneficial, and there's a lot that, you know, people can gain from it by having hospice care come in. Volunteer, we are always looking for more volunteers. Right now we have over 1,000 volunteers, and the bottom line is we couldn't do what we do without our volunteers. They are wonderful. If you have a group and you would like to do a fundraising event on behalf of Tidewell, we do have, it is a, I want to call it an RV park, but it's more than an RV park. They have homes that can't be moved, but every year they do an auction for us. They make things and they do an auction, and it's really a lot of fun, but you know, it's wonderful, and no amount is too small because it goes right into patient care, patient services. The other part of the presentation has to do with advanced care planning and the importance of advanced care planning. Do you guys know what a living will is? Okay. Well, I say there is no easy way to plan for healthcare choices because we really don't know what's going to happen. We don't know what's going to happen in the future. But we like people to consider the following questions. Do I have significant health problems now? What if I received an unexpected diagnosis? And what would happen if I were in an accident? You know, just like hospice, a lot of people think that advanced care planning is only for old people. but hospice and advanced care planning really are for everyone. So what is advanced care planning? ACP is a process of planning for future medical decisions. And to be effective, it should include reflection on your goals, values, and beliefs, whatever those are, your cultural, religious, spiritual beliefs, understanding of possible future situations and decisions. So that would mean looking at what might happen. If you already have an illness, talk to your doctor about how that illness is going to progress. Could you possibly need home care? Could you possibly be in a nursing home? Could you possibly end up unable to speak for yourself or on a ventilator? So there's a lot of things to think about. And discussion of those reflections and decisions with the people that might carry out that plan for you. So advanced care planning is a process of making and communicating your future healthcare decisions. A lot of people get this confused with your last will and testament. When you say living will, they think last will and testament. By having your advanced care plan in place, it reduces stress and anxiety for your family, and it actually can lead to an improved quality of care. And I'm going to give you just a real quick story. And it involves my mother, because I know she looks down on me and says, not again, but my mom did have advanced COPD. She was in the final stages, and she had to be on a BiPAP machine, and she hated the BiPAP machine. But my mom did not have a living will. She did do her, the DNR, who do not resuscitate, but she did not have a living will. So my brother and I had to make the decision whether to keep her on the BiPAP. And that was the only way she was going to remain alive, was to stay on that. And that was temporary also. But when your loved ones are there trying to make that decision, I know from experience, we're thinking of ourselves. And we didn't want our mom to pass away. So we wanted to keep her on the BiPAP even though she hated it. So in one of her very few moments of clarity at the end, she woke up and she said, "Why are you doing this to me?" We felt terrible. But that never would have happened had she taken a little time and had something in writing. So I can't stress the importance of that enough. It also helps to ensure that your choices will be honored. Some people don't want to be on life support. But again, the family that loves you is probably going to try to do everything they can to keep you alive. And the best part of all, it is a gift to your family, and I know because that's how I would have felt had my mom made that decision. It would have been a gift to us, and we would not have had to feel guilty. And we did. Everybody remember Terri Schiavo? Perfect example of why everyone from the age of 18 and up should have this in place. She was a young woman. She had a brain aneurysm, and she's proof that life can change in an instant. She was perfectly healthy, never ever expected that to happen. And I think people just they either don't want to think about it or they don't think it's going to happen. And as we all know, huge court battles. I think it went on for 15 years between her parents and her husband until the courts finally ruled that her husband could remove her from life support. And his position was that she had verbally expressed to him that she did not want to live that way if that were to happen. But, the parents loved their daughter and they were holding out hope for a miracle. So that is a perfect example of why it is so important. So what is a healthcare surrogate? Any adult age 18 and over that you choose to make those healthcare decisions for you. And we recommend that you choose more than one person, because if one's not accessible, the other person is. And you want to make sure that you talk to them and make sure they are capable of making those decisions for you and handling that, and that they can deal with the family, because usually that's where a lot of the issues come up, is the family members all have different ideas about what should happen. So how do you choose the healthcare surrogate? Choose someone who is willing and acceptable, that's willing to learn about your choices, not what they would choose for themselves, that they'll follow your preferences, that they know what your goals are in the event of a sudden incident. They can make these decisions under stressful circumstances, and again, that they are 18 years of age or older. If you have any other questions, Nafi couldn't be here today. Nafi is actually the director of our My Life, My Choice program. She started our advanced care planning program. But if you have any questions about anything, please feel free to contact me. If anybody in here would like to do their advanced care plan, if you don't already have it, if you have one made up, we recommend every 10 years you review it and revise it if necessary, or if there has been a change like a death, a divorce, different changes in life might change how that plan is written. So it's always good to review it. We have all of the forms. We print everything out. They're free, and it's quite a nice packet that we give you to do that. And if you have anything you want to know about hospice that you didn't think of today, please feel free again, reach out to me. Or you can go online, tidewell.org, and hopefully we can help you. Does anyone have anything? Mm-hmm. Sure. Mm-hmm. Absolutely. Okay. Okay, we're not there 24 hours a day, but they will come in. The nurse case manager, the RN case manager, will come in and check the patient. I'm sorry, I can't hardly, I've talked all day. I feel like my lips are sticking together. They will see the patient on a regular basis, and in between that, we have LPNs and the CNAs that come in, and any other, if they need any type of therapy or anything like that, those people will come in. The CNAs will come in and bathe and do, like light housekeeping. They'll do light meal prep. They'll do whatever is needed. I think that's what you were asking, like what, yeah. Yeah, a lot of people think that we're there 24 hours a day. The only 24-hour-a-day care that we have is if someone is actually in our hospice facility. If we have someone in their home and we can't stabilize them and they need crisis care, we will put them in one of our hospice houses. So then they'll have the 24-hour care. Does that answer it for you? Okay. Mm-hmm. That's sort of a decision that can be talked about between the doctor and the family. I know from my own experience, we didn't want my mother to, as we put it, to be out of it. Everybody wants to be able to communicate with their loved one. But at some point, there has to be a decision made that they become nonverbal, usually towards the end. And our staff will look for cues, like on the face. They can tell if a patient is in pain. They're not going to over-medicate. That's never the goal, to over-medicate. Patients that are verbal can tell us if they're hurting. Patients with dementia or nonverbal patients are going to give us nonverbal cues to let us know that they're hurting. Sometimes medications are also used to help with breathing. When patients are in pain, they start to breathe hard and quickly. Pain medication will also help that patient relax. But the goal is never to over-medicate, and I think that's kind of one of those old hospice myths that people think that when they go into hospice, they're just given pain meds just so they're, not there, and that is really, really not true. You can talk to them and discuss, how you feel about it. They don't just do it. Mhm. Hmm. Yeah, we do not participate in that. Yeah, yeah. No, we hospice is to improve the quality of life forever how much time that person has. We definitely don't want people to suffer, but we do not do anything to accelerate death. Okay? You're welcome. Thank you so much.